Hello everyone, so today we'll be talking about HIV and AIDS. Let's first start off with what is HIV and AIDS. So HIV, or human immunodeficiency virus, is a virus that attacks CD4 T cells in the immune system and weakens them to the point where the body cannot fight against other infections and cancers. AIDS, or acquired immunodeficiency syndrome, is the final stage of HIV, where the immune system is so damaged that a person is now vulnerable to opportunistic infections that can cause death. Now, these opportunistic infections include infections like cancers or pneumonia or other infections like that. So the origin of HIV and AIDS, the source of the HIV infection in humans comes from a species of chimpanzee in West Africa. The species of chimpanzee carried the simian immunodeficiency virus, or the SIV, and this virus was transmitted to humans when they hunted these chimpanzees, and the hunters became exposed to the infected chimpanzee blood, and then the SIV mutated inside the humans, and then turned into HIV. So then I also got the role of CD4 cells in HIV. So CD4 cells are T cells with a surface protein CD4, which makes them CD4 cells. They are white blood cells in the immune system that organize the other white blood cells within the immune system to produce antibodies in response to viruses and bacteria. Now, the normal CD4 cell counts in humans range from 500 to 1,200 cells per millimeter cubed. HIV works to attack and destroy CD4 cells using the CD4 cells' ability to multiply to make more copies of the HIV virus and spread it throughout the body. This process is known as the HIV life cycle and is shown in the picture on the right. Now, without CD4 cells, the antibodies become ineffective towards fighting against viruses and bacteria. So let's look at how AIDS and HIV are transmitted. HIV and AIDS is transmitted through exposure to various bodily fluids. Now, most people do not know that they are actually infected with the HIV virus. The methods of transmission include unprotected sex, blood transfusion and exposure to infected blood, sharing of needles with infected blood on them, and breastfeeding. So with breastfeeding, the mothers will pass the HIV virus on to their babies through their breast milk. Now, according to the CDC in 2014, the number of people living with AIDS was 20,896. Now, of that number, 12,624 were adult and adolescent men, and 5,168 were adult and adolescent women. So now let's look at how you become diagnosed and the symptoms of AIDS. So starting with stage 1 HIV, the symptoms include fatigue and aching muscles, fever, nausea and vomiting, diarrhea, sore throat, and a red rash that doesn't itch and is usually located on the torso. Now, AIDS, which is the third stage of HIV, is diagnosed when a person's CD4 cell count goes below 200 cells per millimeter cubed, or the person is diagnosed with an AIDS-defining illness such as Kaposi sarcoma or pneumocystis pneumonia. And then the symptoms of AIDS include swollen lymph nodes in the neck and groin, a fever lasting more than 10 days, night sweats, unexpected weight loss, purple spots on the skin that don't go away, severe long-lasting diarrhea, yeast infections, and easy bruising or unexpected bleeding. So now let's look at how you manage HIV and AIDS. So the main management plan is the HAART method, which is highly active antiretroviral therapy, and it is the recommended treatment for HIV and AIDS. HAART is a combination of at least 2 different HIV drugs that combat resistance by the virus when it makes copies of itself and decrease the rate of opportunistic infections. Now, HEART is not a cure for HIV and AIDS, but is a means of management and prevention from developing severe infections. The HEART program works to control the growth of the virus, improve the immune system function and status, suppress HIV and AIDS symptoms, and then limit the side effects of HIV and AIDS. And then we'll look at the classes of HEART medication. There are 5 classes of HIV drugs that are used by HEART. So first you have reverse transcriptase inhibitors, or RT inhibitors, and these delay and disable the production of the HIV virus. Then you have protease inhibitors, and these inhibitors interfere with the enzyme that the HIV uses to create infectious viral particles. And then you have fusion inhibitors, which block the HIV entry into healthy cells. The entry inhibitors, they do the same thing as fusion inhibitors, where they also block the HIV entry into healthy cells. And then you have integrase inhibitors, and these inhibitors block insertion of viral DNA into host cell DNA. So now let's look at HIV and AIDS and exercise. So HIV and AIDS does not show to hinder or impact the ability to perform physical activity. However, exercise does provide health benefits for those with HIV and AIDS. Exercise helps reduce the risk factors for cardiovascular disease that can develop in HIV-infected individuals. Exercise helps decrease metabolic complications because HIV patients are at risk too for metabolic complications such as diabetes, high blood pressure, hypertension. And then exercise can counteract side effects of the HIV virus and its medication. And then exercise also presents immunological benefits, and these include strengthening the immune system, the enhanced production of natural antibodies to fight viruses and disease, and it has a positive effect on immunological factors that cause disease progression in HIV. So now we'll look at a case study here. Here we have a 30-year-old male who has AIDS. He is 5'10", 180 pounds. He's a non-smoker with no family history of disease. Blood pressure is 134 over 80. Fasting glucose is 90 milligrams. He used to exercise on a regular basis, but is currently sedentary. Total cholesterol is 220 milligrams, but they have an HDL of 70 milligrams. So when you look at this, you have sedentary lifestyle as a risk factor, you have total cholesterol as a risk factor, but because the HDLs are above 60, that takes away one, so you only have one risk factor. And this places the client in the low risk group. Now, the client wants to become active again and improve physical and mental well-being to help cope with AIDS. Now, some considerations to include are awareness of exercising to fatigue, because ongoing fatigue can weaken the immune system, and you don't really want to weaken the immune system anymore with an HIV/AIDS patient or client, because you don't want them to have an increased risk of getting other infections or diseases, or be more likely to get infections and diseases. And then you also want to be aware of developing peripheral neuropathy, which is basically like a stinging or like needly like pain in the feet. This develops with can develop with HIV due to the HIV infection, and can occur in HIV patients. Now, if this happens, you're going to want to tell your client to go see a doctor so they can get medicine for peripheral neuropathy. And regardless, the client should still go see a doctor to determine if the exercise program is appropriate for their HIV/AIDS care plan. So basically just making sure that the exercise plan will coincide and will not interfere with the medication that's being taken. So now let's look at exercise testing. Maximal and submaximal aerobic exercise testing is appropriate for the client since they are in the low risk group, and then same goes for resistance exercise testing because they're in the low risk group, so they should be able to do maximal and submaximal exercise testing. However, in both cases, just make sure to properly assess and treat fatigue caused by exercise because you don't want to risk anything going on with the immune system so that they're not getting any other diseases or infections. So let's look at exercise prescription. There's no specific guidelines of exercising with HIV or AIDS, so they're basically just the same or similar to your just regular exercise prescription for regular individuals. Now, obviously, that would change if your client is overweight or they have hypertension or they have diabetes, then you go off of their guidelines. So, an example prescription here, you have for aerobic exercise 3 to 5 days a week, 30 minutes of moderate exercise of 40 to 60% their VO2, or 20 minutes of vigorous exercise, about 60 to 80% of their VO2. Modes include running, walking, swimming, biking. You can do elliptical, stair climber, stuff like, etc., stuff like that. Then for resistance training, we have 2 to 3 days a week, 60 to 75% of their 1 rep max, doing 10 to 12 repetitions, 8 to 10 exercises working the major muscle groups of the body, and some modes include you can do machines, dumbbells, kettlebells, resistance bands. You can even do body weight if it will meet the percentage of 1 rep max and meet the intensity. And then flexibility, you're going to do that every day before and after an exercise bout for 10 to 15 minutes. You're going to do dynamic stretching prior to exercise and static stretching post-exercise. You're going to be stretching the muscles that were worked or that are going to be worked that day. And then in conclusion, so the HIV virus attacks and weakens the immune system to the point where AIDS can develop. People with AIDS are at a major risk of developing severe, fatal diseases. And then once diagnosed with HIV, you should seek medical attention and get on a heart plan to control the virus and prevent the progression to AIDS. And even though someone may have HIV or AIDS, exercise still works as a means of improving overall well-being and increasing longevity while having HIV/AIDS. All right, and thank you all for listening.